DocTalk is brought to you by Merck Animal Health. At Merck Animal Health, we're shaping the future of animal health with pioneering science, connected technology, and insights-driven solutions to bring our customers an unparalleled portfolio of choices to improve cattle care and operational efficiency. We support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.
Hey folks, thanks for joining us today on DocTalk. You can see we're here at Kansas State University with Dr. A.J. Tarpoff. We're going to have a great show. We're going to talk about calving kits, so much more, something that Dr. Tarpoff does across the state, across the country, putting on calving demonstrations and classes. Thanks for joining us.
They're here, they're hungry, and they can't be stopped with ivermectin. Choose Safeguard when you deworm your cattle to take out resistant parasites like brown stomach worm, Cooperia, Nematodirus, and others. With Safeguard's efficacy, you can kill more resistant worms in your cattle, so you don't leave potential on the table. Consult your veterinarian for the diagnosis and treatment of parasitism. Then bite back at safeguardworks.com.
Hey folks, welcome to DocTalk. Dr. Dan Thomson here with Dr. A.J. Tarpoff. And Dr. Tarpoff serves as the extension beef veterinarian for the state of Kansas, but he's not limited to Kansas. If you know Dr. Tarpoff, he's everywhere in the country. Anything beef cattle, feedlot, cow-calf, pack or retail, he's our guy. And so thanks for joining us.
Always a pleasure to be here, Dan.
It's great to have you. And you have a very unique class that you teach to producers across the state, and you travel to them with different equipment, but you're doing some, in your extension role, you're doing some calving schools, correct?
I do. So I think these calving schools are really important for the everyday producer. Whether you've been in this business for 50 years, been calving out cows, you're brand new, you've never calved a cow, but you're just getting into it. Maybe you've married into a family, an ag family, and you've never really been around this. Doesn't matter what your experience level is. Producers tell me time and time again, no matter what their experience level, they take away information from these courses.
Yeah, and he's humble because there's other calving schools out there, but this guy gets you excited about the information and excited about learning. And so where are we going to start? Where are we going to start? Because we're going to kind of walk you through in a series. It won't be one show. It won't be two shows. It could be 3 or 4 because there's so many things to cover. But where are we going to kickstart this?
I think the perfect place to get things kicked off is understand a little bit about pregnancy and understand a little bit deeper understanding of what happens around calving. Okay, so this mama cow, she's been pregnant for 283, 285 days, that it's grown, that calf inside the uterus. I think of the uterus as that organ is just an amazing organ that grows and develops and nurtures that calf from a 2-celled organism all the way up to an 80-pound calf.
Yep.
And that's amazing.
It is.
And it happens in a relatively short amount of time. So what happens during the end stages of pregnancy, during calving, there's a very set standard amount of things that have to happen inside mama cow for the calving to go appropriately, right? And so what happens is it has to get set off, okay? Something has to kickstart this event known as calving. And, I always question people, it's like, what do you think kickstarts it? Well, it's the calf, right? The calf actually releases hormones into the mom's bloodstream that sets off this cascade of events that once it started, we can't really stall it, but it's a cascade of events of relaxation, dilation, and contraction all at the same time. And when we think about the complex nature of what happens during this time, it's purely amazing to think about.
Everybody asks, like, why do all the calves, why are they born when we have a storm? Oh, here comes a storm, I suppose we'll have calves now. And we think it's something magical, but it goes back to what you were saying, right?
And the hormone that is released is kind of a stress hormone. So if the calf gets stressed during some of those events or something big changes, they had a trailer ride. We had a big windstorm that blew in. Something that this calf got a little bit stressed and says, hey, I'm ready to come out. I don't like this anymore. I'm ready to be born. So sometimes we blame the mama cow for being born in the middle of an ice storm, but in reality, it's a little baby calf.
So when when the rancher takes the wife down the bumpy road on the ride to stimulate parturition, it's not the physical bouncing, it's the fear hormone being released.
It's a fear release of that hormone that sets off that cascade of events. And what that cascade is 3 stages of parturition.
Yep.
And we'll get into those.
Great. Well, let's take a break. When we come back, more with Dr. Tarpoff. We're going to talk about the 3 stages of parturition. You're watching Doc Talk. Thanks for joining us.
Hi, my name is Dr. Kirk Ramsey with Neogen. Today on Cattle Intel, we're going to talk about selecting needles for synchronization protocols. Synchronization protocols always require a hormone injection. And there are a few really important factors that we have to remember when approaching hormone injections in cattle. All hormone injections of prostaglandin analogs have to be given in the muscle. If those injections fail to get in the muscle, they're definitely not going to be as effective, and they're probably going to lead to synchronization failure. This means that depending on the animal's size, needle length and gauge are really important. Probably the best rule of thumb is just to stick with a 1.5-inch needle for intramuscular injections of hormones. Gauge of the needle is a little bit less critical, but the longer the needle, the more likely they are to bend or break, making these injections dangerous to the injector as well as the animal. For most cattle injections, you should probably stick with an 18 gauge, or often a 16 gauge is preferred. When giving these injections, always follow beef quality assurance guidelines for injection sites. This means that the injections are best given in the muscles of the neck. Last, remember, hormones associated with cattle synchronization can be very dangerous. It's good practice not to handle these hormones if you are pregnant or may be pregnant. And always wear gloves and protective equipment when giving these injections. Hopefully these tips have been helpful, and if you have further questions, you can always follow up with your local veterinarian.
Thanks for watching Cattle Intel by Neogen.
Are you a cattle feeder looking to manage for a stronger and more profitable set of cattle? Look no further than Igenity Feeder. Igenity Feeder utilizes DNA to gain insight into your cattle's genomic potential, with the information to predict performance, quality, and economic endpoints for cattle feeders. Animals are scored and ranked in a simple format, driving more precise and accurate management decisions. Igenity Feeder gives you the power to predict days on feed, manage variability within lots, characterize carcass performance, and focus on metrics important to you and your operation. With the data provided, you will identify superior animals earlier and maintain high operational efficiency. Maximize your profit and optimize performance with Igenity Feeder.
John McCurry with McCurry Angus Ranch. We are standing right now in our fall yearling bull pen. On our first initial run with therapies, we commingled 3 separate different pens of bulls together for the ones that's in the sale, and had virtually no issues with these cattle in terms of commingling them and their attitudes towards each other. Didn't have the riding and the fighting that we normally can experience. And I would highly recommend us using therapies, and would recommend that to anybody else looking to do so.
Hey folks, welcome back to Doc Talk. Dr. Dan Thomson here with my friend and colleague, Dr. AJ Tarpoff. We're talking about calving. Dr. Tarpoff is here at Kansas State University, and he is the beef extension veterinarian for the entire state. But today we're talking calving, so let's get into those 3 stages of parturition.
Yep. So I like to break, in general, we break calving into 3 different stages because different things are occurring in each of those stages. Stage 1. Okay, let's kind of jump right into it. And when you hear parturition or calving, it's the same thing. Parturition is just a fancy word for calving, but so if you hear me use both of them, it means the same thing. So stage 1 of calving. Now, we already had the release of the hormones. We have initiation of this going on. Now we're starting to begin things. Mm-hmm. That uterus, think of the uterus as a big water balloon that's been stretching and growing with this calf, that it completely envelops this calf inside the abdomen. And it takes up most of the lower abdomen of mama cow. So she hasn't been able to eat as much. It takes up an enormous amount of space. And all of a sudden, this organ starts to twist, contort, and contract, and actually starts to turn this calf. And if you think about the power of that muscle to be able to, in a confined space, to be able to contort a very specific way to twist and roll this calf and place it into the birth canal. that muscle, that organ is absolutely amazing. And what sets it apart is it's a smooth muscle. So all it needs to be able to hold a contraction is calcium. So as long as we have mama cow on a steady plan of nutrition, she is using her calcium stores within her body, she's going to be able to twist, contort, and contract, place this calf into the birth canal. Okay, so if we think about this twisting, contorting, contracting, all of this pressure has to go somewhere. And what separates the calf from the outside world in the birth canal is the cervix. Okay, the cervix, for those of you that have been doing AI or artificial insemination, and we wrestled to try to fit a straw through that cervix, well, that cervix has to dilate to be able to become the size of the birth canal. And so that's a big amount of dilation. Now, hormones help with that, but all of those pressures that are happening on the inside of the womb, that actually helps stimulate the inside of that cervix to complete its dilation. So we have pressures building, we have kind of a hydraulic pressure from all of that water balloon kind of squeezing and contorting. We also have physical or mechanical pressures happening on the inside of that cervix, which should be the baby calf pressing up against the inside of that cervix. Those two pressures together, those stimuli, help with that dilation process of the cervix. Okay, so we have contraction, we have dilation, but we also have relaxation. Okay, and that relaxation is a different component that really starts with mama cow, and that can start happening a couple days in advance, where some of her big muscle structures of her lower hip start to relax. She starts to walk a little bit more wobbly. Okay, she kind of starts that late pregnancy waddle. Well, a lot of it has to do with those big tendon structures starting to relax. We relax the pelvic floor. We start to open up that birth canal to allow for this calf to be born. Okay, so all of these things are happening at the same time. So time frames, well, guess what? Stage 1 of calving, it takes several hours. It can take half a day. So to begin with, even though we set off this cascade of events, it can still take a big chunk of the day where really she's acting a little bit uncomfortable. And we'll get into what she's showing us because it is pretty subtle in stage 1.
Perfect. We're going to take a break. When we come back, more with Dr. Tarpoff.
Founded by farmers, for farmers, United Patriot Coin stands with you. Diversify your financial portfolio with precious metals, a smart investment for uncertain times. You've worked too hard not to protect your assets. United Patriot Coin, precious metals for a secure future.
When it comes to treating BRD, you want a product that you can count on to get the job done at an affordable price. Macrosyn by Bimeda delivers on both. A straight shooting, no BS tulathromycin that does what it's supposed to do. End of story. You don't need to take our word for it though. Go to macrosyn.com for customer testimonials and head-to-head trial results. For your cattle and your bottom line, choose Macrosyn.
In the livestock industry, castration is a common practice to ensure proper herd management. All methods are painful, regardless of the age of the animal. At Solvit, we could not ignore the clear industry need for better castration solutions. So we developed Lidoband, a novel lidocaine-impregnated elastrator, addressing the pain associated with band castration. It provides local anesthesia throughout the castration process. Lidoband, a small device that can make a big difference.
Ranchers, looking to elevate your pasture management game? Turn to Heinen Brothers for expert aerial application. With state-of-the-art equipment and seasoned pilots, we deliver precision treatments right to your fields. From fertilizers to herbicides, Heinen Brothers has your pasture covered. Visit HeinenBrosAg.com to learn more.
When the ones who have your heart need your help, count on us for everything they deserve, delivered fast. We'll work hard for you so you can work hard for your dreams.
Folks, welcome back to DocTalk. We're here at Kansas State University with Dr. A.J. Tarpoff. So we got through kind of the getting up to the, now we're to the stage 1, stage 2, stage 3, right?
We are. So we've gone through stage 1 of calving. We have contraction, relaxation, dilation, all of these things happening. And we talked about, I took a lot of time to talk about what happens for stage 1. But what does she show us? What does mama cow show us during stage 1? Well, she doesn't show us a whole lot. She shows us a behavioral change. She separates herself from the herd. That's kind of a herd protection mechanism. She's off feed, right? So we have the boss cow that's the first one in the hay ring, and all of a sudden she's hanging back, right? She's no longer licking your driver's side door whenever you pull into the pasture, right? She's off by herself. So separation, behavioral change. She walks a little bit different. Externally, we can see some of those muscles that truly loosen. We can see the vulva start to swell and elongate. We can see all of these different things that are kind of leading us to believe that, okay, something's happening. Now, stage 1 ends when the water bag comes through the birth canal and breaks. So a lot of us, we can see that, whether it's a softball size, it's a baseball size, maybe even a small cantaloupe, we see some fetal membranes come through the birth canal and open. Okay, and people, we talk about the water breaking. Well, it's no different in cattle that we do have that water breaking. When that bag comes through and it breaks open, boom, that's the end of stage 1. Here it's been 6, 12, hours or so that she's been in active kind of early labor. But now once that water bag comes on, now it's time to hit the stopwatch. Okay.
Yep.
So stage 2 is the active stage. This is what we think about active calving.
So this is her trying to get the calf out.
Yes.
Okay.
So that's what the discomfort from stage 1, it really intensifies. Those contractions of the uterus get even more intense and sustained and closer together. So if for those of us that have tried to intervene and tried to help with a calving process, and if you have your arm on the inside of a cow and she contracts, you don't know if your wrist just broke, you lost your finger, you can't feel anything, it hurts, that's the intensity and the strength of these contractions. So stage 1, begin with hormones. Stage 2 happens when the water bag breaks, and it ends with a calf on the ground.
Okay.
So that should happen readily. This cow should go through a very progressive that she lays down, she stands up, she's actively pushing. She's holding her breath, she's hunching her back, her tail comes up, and she is actively pushing along with her contractions. So we can see this, we can see that happening, and she's progressing to get the calf pushed out.
How long should this take for a cow or for a heifer?
Yep. So I like to use the rule of an hour. Okay, so the rule of an hour is an easy way to get around that. By the time that water bag breaks, she should be making active progress, whether a cow or a heifer, within an hour.
Okay.
Now, for a mature cow, it can take 20 minutes,
right?
And that's completely normal. For our heifers, sometimes it can take a little bit longer, but we don't want them to get exhausted. Yep. So a good rule of thumb, keep that in your back pocket. Once you see that water bag break, hey, rule of an hour, that calf should be on the ground.
Perfect. And then stage 3?
Stage 3 is passing the placenta. Okay, and get with your local veterinarian to come up with some type of treatment aspect. But usually we leave some of those retained placenta, if they don't pass it, it's not even abnormal till 12 hours. Okay, so we watch, we monitor, get with your veterinarian, because really it's about controlling infection.
Perfect. We're going to take a break. When we come back, we're going to get into this kit that you should have with you to help you with these cows. You're watching DocTalk. We're glad you joined us.
Hey, I'm Clark Victory. I grew up right here on this little ranch near Chelsea, Oklahoma. Roped and ranched all my life. A few years ago, I had an injury that created what they call a frozen shoulder. And after speaking with the surgeon in Tulsa, he told me that he could make my shoulder better if he did surgery, but he absolutely couldn't fix it. And I called Kansas Regenerative Medical Center. I did the stem cell replacement. By 12:30, my wife and I had lunch and was driving back to Chelsea. We work around here. Some days we work pretty hard around here, and my right shoulder doesn't get sore. It's like a baby's arm.
When you spot BRD in your cattle, that's your golden opportunity to target infection and its associated fever with a single dose of Resflor Gold, the industry standard dual therapy. To learn more, talk to your Merck Animal Health rep or your vet and see label at resflorgold.com. Animals intended for human consumption must not be slaughtered within 38 days of treatment. This product is not approved for use in female dairy cattle 20 months of age or older, including dry dairy cows.
Hey folks, for your firearm and ammo needs, for gun safes and much, much more, and to have it personalized, come visit us at United Patriot Supply outside of Seneca, Kansas. You can also visit us online at unitedpatriotsupply.com. Be sure to say that Dr. Dan and DocTalk sent you, and we'll see you down the road.
Time is money on the farm, and your cows are less productive when they're stressed. The Alertus on-farm test from IDEX allows you to quickly test cowside and identify open or pregnant cows within minutes on your schedule in the parlor, barn, or chute. It's more efficient for your farm, very simple to use, and puts you in control. With minimal training and reliable, fast results, sample-based pregnancy testing is better for beef and dairy producers. Learn more at idex.com/DocTalk.
Hey folks, welcome back to Doc Talk. Dr. Dan Thomson, Dr. A.J. Tarpoff. We're at Kansas State University in the Stanley Stout Center. Beautiful facility if you need to come to Manhattan for a meeting. Dr. Tarpoff puts on. I highly recommend it. All right, Dr. Tarpoff, we are now getting into a lot of equipment here and different things that you need to have planned.
Okay, prior planning is super important with calving. So I just want to dive into it. I think every producer, anybody that's ever been around a cow that you're trying to give assistance to, nothing is more stressful than if you don't have the right equipment.
Right.
And you're scrambling and you're trying to find different things. So prior to that calving season, I recommend to everybody, go take an assessment. Get an inventory. What do you have? What do you need to replace? And make sure you have it all in a nice kit. Personally, I love to keep my calving equipment in a cooler. Okay, doesn't have to be anything fancy, but it keeps things warm. I can take it inside. I can clean it. It's just it's a one-stop shop. I don't have things scattered all over my pickup.
We use them for doctoring and for, you know, you can have different coolers and that, but keeping medicines and stuff thawed or cool is good. Yeah, depending on the time of the year.
So I just, whether you're a fall calver, spring calver, winter calver, whenever you're doing, I like a small handy cooler you can pick up, you can grab, throw in your pickup.
Yep.
But let's talk about some different things that I think everybody should have. Number one is some type of lubricant. Okay, if you think that there's enough lubricant from the natural fluids that happen with the calving process, it's not. Okay, we're trying to reduce the amount of friction as much as possible. Have a good quality, whether it's just a general OB product, very safe, very effective. JB Lube can work as well. It's a dry lube.
Yep. Just add water.
Add water. So any of these things can work. So I think a lubricant is number one. And that's where, if you're unlike me, I left mine out last night and it froze. So I didn't have it in my cooler inside like I should have. Number two is some type of chain or strap. Okay, now I don't have these in my, I typically like to wash them, dry them, and put them in individual bags. Just to keep them, sometimes I'm messy when I reach back into my calving kit. I don't take the glove off. Well, then I don't contaminate everything else. So good functioning chains or straps, always a good piece. Something that's also very handy are handles. Okay, that actually attach to those straps or chains, and they're made to be able to work together, where now I can get a good firm handle and get a little leverage to be able to appropriately help deliver a calf. On top of that, let's stick with cleanliness. Okay, gloves. I love to have both long OB gloves and small nitrile gloves. It helps with a little bit of dexterity. I wear both at the same time with the nitrile gloves over the top. So we have lube, we have gloves, we have something to attach the calf. Also, sticking with cleanliness, some type of lubricant, whether an iodine-based. If you're going to pull a calf, sometimes we like to put some iodine on the navel. We want to keep things clean. So having some of those disinfectant products, whether some chlorhexidine, some iodine-based, good products to have on hand. Other things, safety. Okay, ropes or halters. I like to have both. Okay, having these handy. Nothing's worse than you've got a cow out in the middle of the wide open. You need to get a halter on her, tied her off to hopefully somebody else's pickup. So when she gets up and kicks, she dents somebody else's rig. Know that from experience. So some type of halter, rope that we can appropriately restrain that cow. Okay, last but not least, okay, a rectal thermometer. This is something that I've really started recommending to all producers. Have a thermometer on hand, especially for those for winter and spring calving herds. If you have a calf that got born into the side of a snowbank, and if you don't know if it's hypothermic or not, or low body temperature, that rectal thermometer really comes in handy, where now we can get an assessment, how much help does that calf need? Okay.
Yep.
So on top of that, just a few other things. You may want a bottle or a tube to be able to administer some colostrum. I do recommend having some type of colostrum product on hand, just to make sure, if you have to take that calf out of a snowbank and take it back home to the house and you can't milk out that cow, having some type of quality colostrum with at least 100 IgG that replaces all of that colostrum early in life, super important. But I think these are kind of the basic components to be able to have on hand any day of the week during calving season.
The only thing that doesn't fit in your cooler is a calf jack.
That is a calf jack, okay? And we'll talk about a calf jack another time, but that is a very useful tool that when used appropriately, it's a back saver, it's a calf saver, it's a wonderful tool when we use it appropriately, but that usually rides in the back of the pickup.
Exactly.
Yeah.
Well, just incredible knowledge, and thank you so much for your explanation. And folks, this is one of those that you can pull up and rewind and look at every year before calving. Get your team on board, get your family on board, and get ready for calving. We're just very thankful for all you do, Dr. Tarpoff. Thanks for watching Doc Talk. Remember, always work with your local veterinarian. And if you want to find us, you can find us on the web at www.doctalktv.com. I'm Dr. Dan Thomson with Dr. A.J. Tarpoff, and we'll see you down the road.
At Merck Animal Health, we support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.